Welcome to the latest video installment of the Mississippi Board of Pharmacy quarterly newsletter, The Script. We're glad you're here as we continue delivering important updates in a clear, easy-to-follow video format, keeping you informed, connected, and up-to-date. As we move into another quarter, it's a great time to refocus, stay compliant, and continue strengthening all areas of pharmacy practice. Before we dive into updates from licensing, compliance, PMP, and PBM, let's start with a few important announcements. First, let's talk about upcoming Board of Pharmacy meetings. If you're able, we encourage you to attend and stay engaged with the work of the board. All meetings will begin at 9 a.m. Our upcoming 2026 meeting dates are May 28th, 2026, July 9th, 2026, September 17th, 2026. More dates are available on our website, www.mbp.ms.gov. Meetings will be held at the Mississippi Board of Pharmacy, located at 6311 Ridgewood Road, Suite E401 in Jackson. We look forward to seeing you there. Next, the fax machine's long goodbye continues. For years, fax machines have been a fixture in community pharmacies, but their role is steadily declining. A new CMS rule will begin phasing out the use of faxing for certain types of electronic documentation tied to billing claims. While this change is not expected to affect pharmacy-related transactions, it does mark another step away from fax use across the healthcare system. For pharmacies, it's a clear sign that the move toward more secure, efficient digital communication is continuing and will only become more important over time. For more details on this update, be sure to check out the PDF version of the script. Moving on, registration is still open for the Mississippi chapter of NADI's 2026 training conference. This is a valuable opportunity to gain practical insights and continuing education in the fight against drug diversion. A returning highlight of the conference is the annual agency roundtable, where attendees can engage directly with leaders from public health, the Drug Enforcement Administration, and professional licensing boards. If you're already registered, you can scan the QR code to submit your questions in advance and help shape the discussion. Here's why you should register. Up to 6 hours of Mississippi Board of Pharmacy. Approved continuing education, meeting both live and controlled substance requirements. Focus education on real-world drug diversion trends, investigations, and best practices. The conference will be held on April 23rd, 2026, from 8 a.m. to 4 p.m. at the Brandon Civic Center in Brandon, Mississippi. Scan the QR code to register today. Now, let's take a look at the latest updates from each division, starting with PMP. PMP Clearinghouse. If your facility's controlled substance reporting is sent automatically to the PMP Clearinghouse by your pharmacy software vendor, make sure you have access to the email address associated with the submitter account. Each day, a report of that day's submissions is sent to this email. These reports notify your pharmacy of any rejections, errors, or warnings that need attention. It's important to correct all errors or rejections in the MSPMP database, as required. Having access to these daily reports helps you quickly identify issues or missubmissions. For guidance on correcting errors, please refer to the Data Submission Guide located on our PMP website. Next, all things licensing. Let's talk about keeping your licenses and permits up to date. If your facility's address, ownership, or contact information changes, make sure you report that right away so you stay in compliance. There's a new application category, Medical Device Establishment, created for entities that solely manufacture or distribute medical devices. If your facility distributes both devices and drugs, this pathway does not apply. To ensure you are applying to the correct permit, note that a medical device establishment is intended for facilities that ship devices directly to healthcare facilities, such as hospitals, clinics, etc., while a medical equipment supplier permit applies to entities that provide products directly to patients. A quick reminder for medical equipment supplier permits. The renewal portal opened on April 15th, 2026. Any renewal submitted after June 30th, 2026 will be considered expired, and any renewal applications still pending after June 30th, 2026 will not be considered complete. That means your facility cannot operate under an expired permit, so be sure to submit everything on time. If you're not planning to renew, or if you need to close a facility permit, log into the gateway and submit a permit closure request. And now, a graduation season reminder, our student sidebar. Student intern and extern controlled substance registration cards expire 1 year from the anticipated graduation date. If your date is incorrect, contact licensing to have it updated. Withdrawn students must notify the board immediately. Registrations become inactive upon withdrawal. Withdrawn students seeking pharmacy technician registration must petition the board for approval. Finally, this applies to all licenses and permits. If you have not renewed, please do so before the expiration date. All necessary information is available on the board's website. Compliance check. Inspections continue to focus on safe pharmacy practices, proper record keeping, and adherence to controlled substance regulations. Pharmacies are encouraged to review internal policies regularly and ensure staff are trained on updated procedures. Being proactive helps prevent issues before they arise. A reminder about DEA registrants and power of attorney. Pharmacists who don't own the pharmacy need a power of attorney to order controlled substances under the registrant's DEA number. The same applies if you sign DEA renewal documentation. You must have a power of attorney to show authorization. It's essential to know who the DEA registrant is for your facility. This person can grant the power of attorney. Keep in mind, the DEA registers a pharmacy or facility, not the individual pharmacist. Please call DEA if you have any questions about registrants and power of attorney. It's also inventory time. All Mississippi Board of Pharmacy. Permitted facilities must take an annual inventory of all controlled substances between May 1st and May 15th. You can choose another date, but the inventory should always occur in the same period each year. Keep inventory records with your other controlled substance records. Remember, Schedule 2 inventories are filed separately from Schedule 3 through 5 inventories. Following these requirements helps keep your pharmacy compliant and avoids issues during inspections. Lastly, spotlight on PBM. A reminder for Mississippi pharmacies that the PBM complaint form is available for reporting noncompliance, and the MAC Appeal contact information for all licensed PBMs has been updated. For full details and direct links, please see our newsletter PDF. Thank you for tuning in to this quarter's updates. We hope you enjoyed the video format of the Mississippi Board of Pharmacy newsletter, The Script. For a deeper look into this quarter's topics, be sure to explore the PDF version of our newsletter. It includes expanded details and additional insights beyond what's covered in the video. Stay connected with us throughout the year by following the Mississippi Board of Pharmacy on Facebook, LinkedIn, Twitter, and YouTube for ongoing updates and important announcements.